Hello, everyone, and thank you so much for coming to this medical conference. I will be presenting on the environmental health emphasis in medical school education. We'd like to recognize in the room all forms of medical professionals and medical educators who would be attending this conference. It is my goal today to highlight a disparity between the general understanding of environmental disease in the medical community and the lack of medical education thereof formally. I hope to inspire a more robust curriculum and direct training both for practicing physicians in their continuing education and for up-and-coming physicians in medical school on the causes, treatment, and prevention of health issues related to environmental degradation. My presentation will begin with a brief description on the severity of the problem. We'll transition to the current attitude of the medical education community. And finally, we will go over a few brief suggestions as to how we can integrate solutions into current medical schools. And then after the presentation, there will be a brief question and answer section. First, the continual degradation of the environment is showing its face in almost every aspect of human health. Here we have just a few examples of major organ systems impacted every day across the world. For example, poor air quality can lead to respiratory impairment. The presence of persistent organic pollutants can cause endocrine systems of animals and of humans to be inhibited. And the exposure to herbicides and pesticides can cause neurologic and musculoskeletal systems to malfunction. Furthermore, the risk of exposure to known carcinogenics such as vinyl chloride, benzene, other halogenated compounds can impact almost every organ system in ways both known and currently undiscovered. This all from environmental impacts in the unchecked industrial processes, the militarization, and really even just in modern conveniences that are done in an environmentally irresponsible way. So probably every medical professional in this room could find an impact in their specific specialty or field from the environmental degradation of our planet. And the influence of that impact is measurable. It shows the global cause of premature deaths per year. And as you can see, the largest factor is environmental pollution, causing 15.2 million deaths every year. That is 1 in 4, and more than tobacco, obesity, tuberculosis, AIDS, malaria, and alcohol use combined. Most of those deaths come from non-communicable diseases, such as cardiovascular disease, diabetes, obesity, and even behavioral disorders such as schizophrenia. And the influence doesn't stop there. Even in communicable diseases, such as those transmitted by bacteria and viruses, the impact of pollution can aggravate our susceptibility. For example, COVID-19 rates were 4 times higher in the United States in areas of poor air quality and in areas of recognizably better air quality. And that's after fixing the statistics for different population concentrations. So 25 to 33% of the global burden of disease can be attributed to environmental risk factors. So one would think that with these really striking statistics, that's 25% of all deaths being caused by environmental degradation. And on a conservative estimate, 25% of global disease burden, both in health and economically. With such striking numbers, you would think this would be on the forefront of our minds and research as medical professionals. And yet we don't see that reflected in our educational processes. Now we'll move on to the general medical attitude in regard to environmental degradation. And in good news, most medical professionals feel that it needs to be, feel strongly that it needs to be encouraged in education. Here we have a study that showed what medical educators felt was being emphasized in their programs versus what they felt ideally should be emphasized. So when it came to environmental health, there was a full point disparity on a scale of 1 to 5 between how they felt that environmental health should be treated in their programs versus how it was actually being treated. As physicians who have taken a Hippocratic oath, we have promised that we will prevent disease wherever we can, for prevention is, quote, preferable to cure, close quote. There is a responsibility we have to warn, treat, and refer in accordance with the data that we have available scientifically. Just as physicians warn of the impact of dietary issues on health, or even in the 80s, when physicians rallied to, and I'm quoting a New York Times article here, quote, inform the President and Congress of the medical consequences of nuclear war, so that policy decisions can be made with adequate factual information, close quote. So it's always been the physician's duty to warn against whatever factors could impact the health of our nation. But we cannot warn against that which we are not educated about. There has been politically a separation of public health from environmental protection for a number of years, and this has led to the virtual elimination of coursework and environmental health science from the curricula of most medical and nursing schools. So this current lack of basic environmental health content is pervasive throughout all of America in medical education. But in general, most medical professionals feel that they would like to understand better these impacts. They know that preventable illnesses of environmental origin exist, but feel ill-equipped to educate their patients on the many common exposures and the consequences. In fact, in a recent study, it was shown that 24% of medical schools have no required environmental material content in their curriculum, and even schools with environmental material averaged only about 7 hours of instruction. That's about 2.5% of the curriculum, which is, of course, quite the disparity between the 2.5% we're teaching and the 25% of deaths that are being caused every year by this issue. So what can we do about this? When faced with the idea of integrating new material into the medical curriculum, research shows that medical administration consistently has 3 concerns. First, an overly crowded curriculum to begin with. This can be solved with integrating environmental health into the existing courses rather than adding a whole additional course. In fact, that's preferable, as studies have shown that an integrated curriculum rather than segregated course material makes learning more meaningful, more enjoyable, and produces better clinicians. Secondly, limited qualified faculty. This last year with COVID-19 has proven that distance-based learning is not only possible, but it unlocks new opportunities for learning from the world's leading minds in all fields. And lastly, the inadequate funding and materials. This is understandable and always a pervasive issue, but with emerging materials now being provided every year by both the government and nonprofit sources, there are ample opportunities for effective teaching. Thank you so much, and now we'll turn the time over to the audience if there are any questions.
Yeah, I have a question to start. How long would it take to implement something like this into a medical school curriculum?
That's a great question. Although this is, of course, different than integrating an entire new class or an entire new course into a medical school curriculum, it could be done almost immediately with the right faculty. Because in the coming years, there are already qualified professionals who would be able to add in on different organ systems and explain to students how different organ systems could be impacted. So with the right resources and funding, it could be done in the coming school year.
So I have a question in regards to some of the diseases related to this, but from the research you've gathered, what are the most common manifestations of pollution-related diseases?
That's a great question. It was previously thought that poor air quality could impact only respiratory diseases such as asthma or COPD. However, with new technology, we're finding that even aspects of your blood pressure or your neurological function can be impacted by air pollution. So really, with each new emerging step in the research, we're finding that different organ systems are impacted by environmental pollution in ways that we had never even previously imagined. So that is really a very developing field, but definitely the respiratory system, the neurologic system, and even the endocrine system.
I also have a question. Great presentation, by the way. At the end, you talked about the major concerns, and for the issue about the inadequate funding and materials, the solution was the government-sponsored materials. Where can I find more information about those?
Great question. Specifically, the Agency for Toxic Substances and Disease Registry, the ATSDR, has a lot of great materials coming out for specifically medical programs, but I can provide a full list of those resources after the presentation. Are there any more questions? Okay. Well, thank you so much for all coming to the conference. I appreciate your attention, and have a wonderful evening.